for those that are considering joining a group practice, what should they look for in terms of culture, support, operational setup?
One of the most compelling reasons that people join group practices is because it's great to have peers in this field. It is a passion field, but it's also can be a very stressful and difficult field. If you think about, people are coming to you with often very severe problems and looking for you to help them in life, and having colleagues that can provide support to you can be invaluable. And so a lot of people choose group practice just because they want the support from peers and colleagues. I think that telehealth has once again changed some of this support a lot. So if you are looking for, hey, I've got a half hour free, I'm going to walk around and see whose door is open to ask them about this case, or see if someone wants to grab a coffee and take a quick walk. You want to be aware then that you're looking for a practice with offices where people come in and see people in person. And there are lots of those types of practices that do exist. But if that's one of the main reasons that you're deciding to go to a group practice, be careful if people are just all working from home doing telehealth, and then the company isn't doing anything to provide online chat channels or online meetings or online lectures that can bring some of that sense of community in. So that's a first thing that comes in my mind. Then your questions about culture and support. Well, I'd like to think that mental health clinics that have been started by other clinicians are going to be pretty good on the culture piece. There are a lot of clinics that have not been started by clinicians, though. And so being aware of what's been set up in the group practice, is it set up by business people that are just trying to churn out patient visits at any cost? Or whether it's business people or other clinicians, have they taken steps to make it a great place to work in terms of what mental health clinicians value? And so if you think about that, that's probably, lunch and learn events. It is some sort of group process. It's funding for attending conferences. It's different learning events, guest speakers. With the clinics I started, my goal was to make it like a academic center without the academic bureaucracy. So we like to bring in speakers. We got our own CME accreditation so we could host events. We would let our clinicians have some protected time, 10% of their time to be protected for a special project that could be anything mental health related. So sort of providing pay and support, because a lot of people in this field do have things they're passionate about. Those are where a group practice can far outshine anything that a solo practice can provide. Talking to clinicians from the different group practices, people who've been there a long time and short time, is how you can collect this information. And I would say never trust the people who are doing the interview or trying to do the hiring, but always make sure that you speak for other clinicians at your level, i.e. master's, PhD, or physician or nurse practitioner that have been at the company, to see what that culture is really like.
Yeah, I think that's great advice for any job that you might be joining. Trying to do some networking, reach out to the people who either currently work in the type of position that you're applying for, or have historically done that position. Maybe they left or got promoted, or something. But yeah, networking with those people to really understand. Like, I think that'll give you the best picture of what a company's culture is like. The recruiting department is always going to be, the best possible face for the company. So yeah, always great to do your due diligence and network with the anybody who you would become your coworker if you began working at whatever place it is. In this case,
Right.
Group clinic.
right. And I think especially for people who are using a recruiter to find their group practice, recruiter or headhunter, which is very, I think physicians all have some experience with this, but now it's even more common for non-physicians who are in the mental health field to use recruiters. And the recruiters, get a chunk of your, the employer has to pay them a chunk of your salary for 1 or 2 years. And recruiters notoriously will bend the truth to make it seem like the best situation. And I've recently had several colleagues who were smart enough that after, kind of wrote down all these promises about the workplace the recruiter had said. And when they talked to the actual employer and talked about the specific benefits, it was really outright lies that with some of the things that were being promised. And so many people don't take that extra step of diligence, and then you sign a contract and you're locked into a job. Well, you're never locked in to a job, but you've wasted time and have landed in an environment that is not the right fit for yourself. So, yeah. And you're right. It is sound advice for any job.